right. Good morning, everybody. I'm Mary Beth Saxon Parr, a manager in operational finance in the Triad region. Just so you know a little bit about me. So I'm a Novant teenager. I've been here for going on 16 years, and I've been in op finance the whole time. I feel like I have a new job like every couple years because we shuffle things around and whatnot. But when I started off with support services over at FMC. So I've been working with plant ops for a very long time. So I know what you guys do. I appreciate what you do. A lot of folks do their work very quietly and you're in the background, but I know you keep things running in the hospital, and what you do is important. So I want to call that out kind of first and foremost. So I was really happy when I got invited to help teach this class, and I hope to get to know you guys a little bit better. And I hope that I can um, transfer some of my knowledge to you and so you guys can understand the bigger picture as well as your individual picture on what it takes to look at healthcare finance, why it's important, and the role that you guys are going to play in it. I'm pretty casual, so if you have questions along the way, if you have anything that you want to say, just raise your hand. Lindsay's going to be kind of monitoring, for hands raised, so we can help answer questions as we go. Okay, so tying back our cause statement, I do want to talk about that for just a minute because you guys are like us in finance. We're kind of in the background. We're not patient facing, but these things still apply to us, like discover, empower, thrive in together. So just in discovering, there's influences that we have with innovation and research and those things that we're looking at to help support technologies and move things forward. Empowerment, when we're looking at um, educational resources, things that, community outreach initiatives, and like shared accountability in what we're doing and the services that we're trying to deliver as they relate to plant ops. Um, Thriving, we do that together by making sure that we have quality improvements, we have safety protocols, um, any kind of direct initiatives by operations on spend for health and safety. And then together, we're doing that kind of collaboratively. So from my selfish perspective, that's like you and I working together on what we can do, but you guys are also, you're training your employees and you're working on engagement efforts. So those kind of direct things do apply to all of us and our daily functions. All right, so for the housekeeping, if you would just make sure you keep your cameras on and we have some active engagement. Please use your chat and keep your mute on. I know that calls come up and hospital's still running. We haven't closed the doors. So if you could raise your virtual hand as mentioned earlier, and please engage in discussion. Um, there is I think finance is really fascinating. I get excited about the numbers. They tell a story, and I hope you can see that as we go through things. So we just encourage some, encourage questions and debate. And also, if you have stories to share that are relatable, I think those go a long way. I learn from them. So if things come up, um, uh, please let me know. Please feel free to share. All right. So you know a little bit about me. And we're going to talk about the financial landscapes. We're going to talk about some big picture items. These are headwinds. These are things that all all healthcare facilities, whether they're independent or if they are part of systems, these are things that we're all facing. And we're going to talk a little bit about budget and capital expenses. And there's a reason for that. And then we're going to get into like the nitty gritty, the actual operating, like on a month to month basis. What's your role in that? What reports are you going to look at? And then we'll talk a little bit about CapEx expense, and we'll have some Q&A. But those last couple of items, they're going to prep you for your homework. And don't worry, we're going to take a couple of breaks in here. We're going to cover a lot of ground kind of fast. We'll take a break. We're going to jump into some reports, and then we'll be rounding out our session. All right, so we're gonna start our intro here with a question. And Lindsay, correct me if I'm wrong here, but we need everybody to look at the QR code and get joined in at the Slido, and so you can enter your responses. And we have a couple of these throughout the slides.
That's right. And there are 10 of you, 11 of you. So I'll be looking at this top right corner when I see that we have 11, all 11 of you have responded, then I'll go ahead and reveal the answer. It's anonymous, so we don't know who's answered what. So feel free to answer just as you'd like.
And there is a, just so you know, there are a lot of answers to the question. Lindsay, so we'll go through the Slido, and then I want to pause for a minute because what I would like to, yeah, I want to see what everybody had to say, and then I'd like to learn a little bit about everybody in the room today. So I'd like to go around because these things kind of, affect your perspective, and I'd love to see, kind of, you know, who you guys are and learn a little bit about you and your roles, and then that will help me understand some of what you're answering here. Okay, so we have vendor cost, yeah, supply cost, competition, insurance, yep, support to maintain and repair, yes, CMS funding, yes, weather factors, yes, economic health, payer rates for reimbursement, supply chain costs, contract labor, yes, government bills, weather, outside contractors. Yeah. Yeah, and I would say I think that is right. There's the big things that impact the health of the financial health of an organization. You guys have hit a lot of those things, right? So payers for sure. So what do we get paid for our services? You're talking about costs here. What does it cost to deliver that care of service? So that's your things like your supply chains, your outside contractors, um, all those things. Weather. So when you say weather, I know immediately we have the snow and ice, but I'm also thinking about down east when we have hurricanes and things like that. So my Brunswick, New Hanover friends, you know about those for sure. Um, so yeah, these are good answers. Can you scroll to the top just a little bit there for me, Lindsay? Yeah, vendor cost, supply, competition. Yeah, I did want to touch on that because competition is different these days. Competition used to be just we had a competing facility down the street. That is no longer the case, right? We have other types of competition. We have, who all here wears an Apple Watch? Right? You have somebody, checking your blood pressure or your pulse, um, and we have other means to go in. There's other competitors that want to get in on the market. All right. Thank you for sharing. If you don't mind, can we get a volunteer to start us going around the room and just tell me who you are and kind of how long you've been here, where you working? I already know Will.
John, you had your hand raised first, and then Alec.
Yeah, my name is John Patterson. I've been at New Hanover Regional Medical Center back since it was New Hanover Health Network in 2004 as a electrical contractor, and I got hired on with the hospital in 2016, passed up a job in '05 as electrical foreman, and then in August of last year, I merged to design and construction management. Same day, started same day as this class. So
Excellent.
that's been a battle.
Hey, my name is Alec Fur. I worked with Excellent, a telecommunication company that is contracted for Novant Health for about 2.5 years. And then I switched over into the role of a maintenance floor technician for the last 3 years. And I recently am trying to get a hold of a good grasp on the locksmithing for PMC, which it's proving difficult, but I'm making my way through it.
Excellent. Excellent. Thank you.
Chris, do you want to go next?
Yeah, I'm Chris Hershey. I'm a 30-year electrician, been with Novant for about 3.5 years, and I'm in the trade services department, and just trying to better myself in this class.
Excellent.
Joe?
Yeah, my name is Joe Alford. I'm with Presbyterian Maine in Charlotte, with the trade service on the HVAC side, and I've been here almost 9 years, coming up in March. That's pretty much it for right now. I'm stationed at Maine full time now, so I'm not traveling to the other facilities.
It's a
without
big
work.
place.
Yes.
Jeff?
Thank you.
Oh, we can't hear you yet.
I'm Jeff McMurray. I've been with Novant for 15 years. I'm currently the supervisor of the shared services and the upfit team in the Winston market. Been in construction for probably better than 40 years.
Excellent, excellent. My team does the transfers for those with Mia Leftwich.
Mm-hmm.
Yep. So, and we worked with Upfit for many years when Ben was over it.
He still is.
Yep.
Gina?
Hey, I'm Sheena Baker. I am a fire alarm technician here at Novant. I work out of Shared Services, FMC. So I started my career as a firefighter and worked my way out of that position into a fire alarm inspector for Johnson Controls, and then transitioned here to Novant. I've been here at Novant for a year and 22 days.
Oh, wow. Okay.
Yeah.
Tanya?
I'm Tanya Trivett. I am a regional real estate transactions manager. I am over the Charlotte region, although I sit in Winston. I've been with Novant a little over 4 years, but have been in real estate my entire career.
Oh, excellent.
And David?
Yeah, I'm David Hicks. Been with Novant 6 years. Before that was with Duke Hospital, and then also did construction for 10 years as an electrician before that.
Okay.
And Monroe?
My name is Monroe Kelso. I'm out of Foresight Medical. I do HVAC technician. Prior to Novant, I was a facility director for 7 years for a nursing home.
Okay, fascinating. All right, so we have a lot of diversity in where we are and what we do in this group, and there's a lot of talent. So I see that from all over. I will share one little fact here. Ken Mowry took us on a tour of the power plant over at FMC, the new power plant. That was fascinating. I have a lot of relatives that are in Pittsburgh, so when I saw the big steel logos in there on some of the machinery, I was taking pictures of that. And anyway, it was really fascinating to go through there and see how all those operations work. All right, so let's move back into our
Hey,
business.
Mary Beth, I'm sorry. We skipped over Josh. I didn't want to just completely ignore you in case you wanted to introduce yourself.
Oh, I'm sorry.
Josh Whaley, supervisor at Pender Medical Center in Burgo. I've been here for about 7 months. But I got 10 years in healthcare through UNC, Vidant Health, ECU Health. So
Okay. All right. Well, welcome to Novant. All All right. So we were looking at some of those factors, right? What are these big, what are things that are going to impact our financial health? And all of those things are correct. So when we look at these things, what we're saying is that things change quickly with COVID, and that's essentially what this slide is saying. So with the scope of, policies under the current administration, things are still changing. It's still a very new administration, but we do know that there are things that are already in motion that are headed our way. And basically post COVID, things changed quickly. They changed pretty dramatically. Costs have risen and haven't declined very much. People got used to paying those prices. We have other things that they're in place now with some tariffs and things that are also affecting things that we purchase. And we're basically looking at higher costs and lower margins. So that's essentially what we're looking at. And some of those bigger things that are going into place, those are things like our Medicaid expansion, our HASP participation. And HASP is a healthcare access stabilization program. And also changes coming to the ACA. So there's big legislative pieces coming down. And then we have other factors that kind of that roll into that. So Lindsay, can we go to the next slide, please? So this just kind of shows you the cascade of how these things happen. So for those of you that were thinking about insurance and carriers and what we get paid in government payers, that's kind of the top layer of that's the top of that umbrella. So when I'm talking about Medicaid expansion, this is something that went into effect that North Carolina had not taken any type of participatory role in until December of 2023. And what that Medicaid expansion did is it covers adults ages like 19 to 64 with up to 138% of the federal poverty level. So think about it this way, that somebody that's earning about $21,000 annually for an individual, or about $36,000 for a family of three, but it helps provide some coverage to those people. And the HASP money, that hospital assistance program, that was something that we started participating in 24, and it enables hospitals to get some reimbursement for Medicaid services. So Medicaid is traditionally one of the lower paying reimbursements, and cost of care is about what we get reimbursed, sometimes lower than that. So that was providing extra dollars. So these things are happening kind of on that national level. When they have that legislation, what happens is that, when they shift those things out, and like with the ACA, those, I don't know if you have anybody that's young in your life that may be in between jobs or has a job that doesn't offer insurance, but that's what the Affordable Care Act was designed to do. But we saw where those three programs were kind of expanded, and we saw that more people had access to health care. Now that's important for Novant because, we have 64.5% of our payers are governmental payers. So when these things happen, so that's our reimbursement coming in. You're talking about 64 and a half. So that's well over, it's almost 15% more than half, right, of our payers are governmental payers. So these impacts are things that we are definitely paying attention to. And these things they trickle down. So we have those national policies, which shoulders kind of roll to state. And then so if they're they're stepping back from these governmental payers, then it falls to the state to help try to cover people. And then we have these other factors coming in with supply chains, inflation, labor cost, and that all trickles down to the patient access and coverage, right? So we saw this for those of you that were around or in healthcare around 2008 when we had the economic downturn. What that leads to is delay of care. So people don't, they can't afford it. They don't have coverage and they delay their care. So they come in sicker, they stay longer, which drives up that healthcare cost. And then we don't get reimbursed as much. So at the end of the day, what does that do to us as a healthcare system? It makes our margins smaller. And we are a not-for-profit. So we reinvest our dollars back into the system. So we're looking for certain profit margins so we have the ability to, pay our talent, invest in capital so we can buy the best equipment and provide the best care in the best setting. So that's what we're looking to do. But those things kind of roll downhill, and we're looking at these changes in trying to navigate that. Okay, so next question. Which of the following trends is most likely to impact how hospitals deliver outpatient care in the next 5 years? So if you just take a second and key your answers in, that would be great.
We just need a couple more people to respond. And take your best guess, if you don't know.
All right. I can see you're paying attention. So, yeah. Yes, there are several factors, reimbursement rates. There's definitely directive for insurance carriers. And here's going to be my one piece of investment advice. Invest in insurance, and those guys never lose. So there you go. We are looking at reimbursement rates kind of decreasing for inpatient services. So there's a lot of changes in technology that that are looking, that are kind of pulling people to that outpatient setting. Some of that is looking at our changes in care. So those things shift our services towards outpatient. So we're looking at those reimbursement rates for sure. And I can give you an example specifically like for infusion services. There's been a big change in reimbursement where insurance companies are saying, hey, I know you have infusion services here, but we really want you to do it in an outpatient setting because it's less costly than it is to do in an inpatient setting. So we're actively, trying to figure out how do we move our services so patients are still able to receive the care that they need and in a safe setting, and we're able to maximize our reimbursement on those things. Instead of having the higher cost inpatient, we're looking at a lower cost outpatient setting and moving people in that direction for that needed service. All right, so we have different disruptors and trends. Those are those things that we were talking about. As long as I've been here, there's been a nursing shortage. So we've been looking at nursing shortage, trade technicians. You guys are not, excluded from that. When we're trying to find people that have certain very specific skill sets, sometimes that they can be hard to find, especially if we have competitors that are trying to absorb that talent as well. We were just talking about care moving out of the hospital. So there's a lot of pressure from insurance companies and in the government as well to try to find lower cost ways to deliver care. Regulatory, so we're seeing rollbacks in some of our mandates related to kind of EPA stuff, where we might have gotten some incentives for going with more green energy type of things, and now we're still looking forward to try to do these things because we've had kind of a whiplash effect from administration to administration, but we still have to navigate that. What do we need to be compliant with, and then what is going to be the best method for us to navigate, to operate in going down the line. So supply chain, we talked about those things earlier too, where we have raw material shortages. We have some, costs for steel and aluminum that are going up. We have not as much as we used to, but definitely we have to kind of plan out some of our projects because of the lead time that is needed for these items. So these are all things that are kind of headwinds that are coming at us. They're things that we're aware of and we're looking to navigate. Okay. All right, let's take all of that, all those headwinds, these things that we're looking at, and these are things that, like I said, all systems are looking at. They're looking at, even if you're a small independent hospital, these are all things that people that are facing, and we need to bring that back in and see how does that apply to us. So it's not all doom and gloom. There are things out there, being aware of it and figuring out ways to navigate in it and around it is what we're doing. So let's take this down to how does that apply to us? So I've got 3 questions here. So we're considering these challenges. and in how every department contributes to this. So I want to know if you guys are aware of Carl's goal for Novant. Where is he trying to take us? And then what kind of challenges do you think we have? And how do we fit into this? And that third one is where we'll spend some time. The chats. What are what's our goal from Carl? Is anybody familiar with that message?
He wants to be a $30 billion organization by 2030.
That's correct. And he's talking 30 billion in revenues.
Yeah, from 10, right? 11, isn't that where we're currently running?
Sorry, Will, I couldn't hear you.
I said from 10 or so, right? That's approximately what we're
Correct.
running at right now.
That's correct.
So that's a 3x in 5 years from when that was
Mhm.
put forward.
Yeah. Yeah. So he's got strategies, and I don't know if you guys heard about an NHE department, Novant Health Innovations. So you'll probably, if you haven't heard of that term, there's effects that you're seeing from it. I mean, we're looking at adding a lot of ambulatory surgical sites. That is a main focus right now. Tanya, you're yeah, you're nodding your head. You're like, oh girl, I know. We are looking at some real estate. Yeah, so we're trying to expand services. Yeah, investment, Sheena, that's a good one. Always on the back end, they're looking for ways to invest kind of our residual monies and investment in these growth strategies. So, David, you kind of have all of those listed. Technology, yep. So that goes back to our capital. We're trying to invest in technology. Yep. Okay, so let's talk about the challenges. So what challenges do you think we have to becoming this $30 billion company? You know, we're changing, and why are we changing? Is because healthcare is changing, and we need to adapt. So it's not just our bricks and mortar where people come in for services. So what other challenges do you think that we have? Yeah, definitely staffing. Yes, the big beautiful bill. Yep. They're actually the new term I've heard for that kind of is 3B. Yeah, marketing, manpower. Yep. Equipment costs. Yep. License on software. Yeah, licenses on software. We actually are changing the way that we're offering some tools to nursing, because not every nurse manager has full-blown Excel license. And it costs to have those licenses. Competition, yep. Exactly, Sheena. Yeah, technology, Apple, Amazon. Yes. So it's not just our competitor down the street. We are now across North Carolina and South Carolina. So we have, the bigger that we expand that footprint, the more people that we have, and then we have more competitors along with that territory. So some of the things that we're doing to combat that, so we have full service walk-in clinics like on the weekends, and we're trying to expand some of those services. I know if you guys have kids or grandkids, you know, pediatrician's office might be open on a Saturday or a few hours on Sunday. So we're looking at those competitors, like you have a Walmart vaccine clinic or a CVS or a telehealth. To Sheena, to your point with the social media platforms like X said they wanted to jump in the game, right? Amazon and Apple want to jump in the game and help deliver healthcare, whether that's pharmaceutical deliveries or telehealth. They're all looking to get in here. So we have those things. We have the way healthcare is delivered. We've got increased cost of doing business with supply cost, labor costs. We've got shifts to value-based care. If you haven't heard that term, it's kind of a continuum of service. So if Mary Beth slips on the ice and I have a knee injury and I have to have my knee repaired in-house, but then I have to have some outpatient rehab too. Well, I'm going to go to one of our outpatient sites, and they're going to look at my full care from beginning of service to end of service and say, hey, did Mary Beth need to get readmitted? Oh, did she? Well, we're not going to pay you as much money because we feel like you should have been more attentive to her. And so your reimbursement isn't going to cover just like it did fee for service as it has in the past. So we get paid kind of on the back end. And if we figure out how to be innovative and deliver that care, so I have a shorter length of stay and maybe along with that rehab to have that good outcome, and then I get a little extra reimbursement on the back end for that. So it's for the full services, and that's what value-based care is. And we talked about ways that we're adapting. We're finding ways to deliver that care and services, mobile clinics, extended hours, weekend hours. We're expanding sites. We had, you know, Scotts Hill down east, right? We took on South Carolina. We have a new tower at FMC. And then we have Kernersville had an expansion a couple years ago, so we added cardiovascular services there. So now people can go. We have a cath lab, EP lab. We got babies at Kernersville now, so we didn't used to have babies, but now we do. So we're finding new partnerships and innovations, you know, ways to trim cost and kind of increase our efficiency. So that Novant Health Enterprise Group, that NHE, so when they're going into, they're looking at partnerships with people, joint ventures. They are looking at how can we offer Novant services maybe for supply chain to help buy some goods for some smaller facilities that would otherwise not have as much buying power. So there's lots of ways that we're looking to be non-traditional healthcare, but still provide healthcare. Have you guys heard of anything? Okay. All right, let's take that down to how do we fit in? How do we fit into this? So we have all these, you know, these headwinds, things are changing with regulations and payers. We've got costs that are going up. And we're trying to figure out, well, you know, how do we deliver this care? And when it comes down to us specifically, we're down here kind of at the back end. That's you and I. We're on the back end of these processes. We're not patient facing. So what are we doing? So I'm gonna start with going back to, we're not for profit. That's part of our mission. We're not for profit. This means we're reinvesting our margin back in the system for capital and back into its people, to be able to pay for our talent. So we want to have the best equipment and that best care and talent to take care of people. So when we're doing this, we need to come together, because every department is a little micro business. So we have all these different pieces and parts, but when we roll it up together, we collectively build this financial picture. Some areas bring in money and others don't, but everyone is needed. So in our departments and plan ops, we're not revenue generating. If I'm a nursing unit or an operating unit, I'm generating money because I'm providing that service. But what we provide here is the support for those services. And all of that, they can't provide those services without us, right? They need us to be there, and we need Johnson's controls, right? We need to make sure our fire alarms are working. We need to make sure that we're compliant, because if we're not, then we get fined and we have to remediate, and all of those things cost more money. So if you don't invest in your house, you're going to fix it sooner or later, and the more you put it off, the more expensive it gets. So it is important that, what we're doing is we're paying attention to what we're doing and that we're being fiscally responsible. So even though we're not generating revenue, we still need to do our part, and we need to manage our department. This is your business, and you need to kind of treat it as such. So what are key areas that we're going to look at? We're going to look at labor. Labor across the system is the biggest expense that we have. It is at least 60% of our costs is in labor. So that's quite a bit. So, we want to look at those things and make sure that we are running efficiently. Yeah, and Sheena, I see your comment there. We're being productive and we're being proficient. Now, I have seen some really interesting things come out of this group, and what kinds of things that we provide that are they're innovative. I mean, some of them might sound small. Yeah, negotiating low rental rates. Yes, those are important things too. Yeah, we want to, when we're looking at leasing places, we want to make sure that it's a reasonably length lease, right? At a competitive rate per square footage. Yep. And so those are things that we look at on the back end when we're looking at pro formas. We're saying, hey, we want to do this. What's our cost per square foot? And then, I can tell you for sure, when we were looking at those things before COVID and after COVID, it was a way different story. So your department is your business, and that you need to manage it as such, because all these little pieces come together and they make the bigger picture. But everybody needs to be responsible for what they're doing. Now, I will tell you the same thing that we would tell nursing units, right? It's not all about slash and burn. It is about providing the right amount of service at the right cost. And we have to balance that. So can we go to the slide, please? Thanks, Lindsay. So we talked about Carl's goal. We talked about some of these challenges to achieving this goal. And then we're talking about how we fit into this. So in the chat, I saw several different things that, and some of those that we talked about here, right? So we're managing like it's a business. We're being fiscally responsible, and we're providing that service. This is where I'm saying that we need to balance. We need to support our innovation through technology and efficiencies. And then all of that helps us uphold our not-for-profit mission. Now, the technologies and some of these services, this is again where I look to this group, and I think your leaders also look to you for innovation on, like, what are we doing? Each of you has a specialty, and I think you all have unique insight to what you're seeing on that front line. Like, why do we do it this way? Could we order something differently? Can we, if we had a different approach to how we maintain something, maybe those are all ideas that we're looking to bubble up and see if that's a best practice. Okay. Next slide, please. Thanks. So one of the deals that we have is this Infra. And how many of you have heard of Infra? Yeah, several of you. I can't see everybody. I'm seeing hands raised. Okay. All right. Infra it's a non-traditional method that we're actually generating funding for capital for hospitals. So the traditional method is like what I'm talking about, right? We provide services, we get reimbursed, and then we have revenues minus expenses, and that gives us our margin. And then those dollars is what we're looking to reinvest back into the system. So this is an agreement where there's an energy savings, but Infra kind of foots that initial capital cost for projects. And so these are things that we want to do that we would do anyway. They're just helping us get there a little bit faster by giving that money up front. And then we're benchmarking these savings, and the kind of the guarantee in there is that if we don't meet the savings plan, then we get a repayment from Infra. So it's important for you as ops leaders to understand which projects kind of fall into this scope of what's an Infra project, so there's not duplications of requests. So for instance, like replacing an air handler. So for projects, definitely check in with either Chip or maybe Tim McMurchie to see if you have something that could be a capital item, if it's covered under this Infra agreement. So check in with them. This agreement right now is specific to just the facilities, so just the hospitals. And I do know that they're looking at expanding this partnership with a company that would do the same kind of thing for our non-hospital locations. And before we move on, I want to circle back for just a second to some of the innovation that I was talking about bubbling up. And I'll give you an example of a couple of things that they might sound small, but they actually, are ways that we're saving some money, and we're helping reduce some of our waste costs too. And one of them was a recycling program for cardboard. Are you guys aware that we do that? So we order a lot. We get a lot of boxes in, and this cardboard was filling up our dumpsters, and then we have to pay to haul it off. So we introduced a program, and this is something that bubbled up through somebody in plan ops that said, why are we throwing all of this away? And we're paying we're paying for this service to come out quite frequently to haul it off. We could recycle that and get some payment for the recycling, and we reduce our cost with waste management. So my understanding is that was kind of a front line. Somebody was looking at that and said, why are we doing this? And they questioned it and came up with a better way. All right, now we're going to get into more directly of my world. Let me just pause for a minute and see, does anybody have any questions thus far? Is there anything that you might want to discuss thus far?
John?
I don't really have a question, but on our end, we don't make money, so we have to make ways to save money. So when I came in and became foreman of the electrical department, I immediately, I've been involved with projects since '04. I negotiate labor rates. I negotiate material costs.
Mhm.
Actually, I've had essentially three electrical contractors work. They work full time, and I work those three electrical contractors at a labor rate of $56.60 an hour, which I can guarantee you shared services can't beat that number. Along with, I've been in the business long enough that I negotiate material prices, procurement, along with. Hey, we don't have enough real estate to store everything like we would like to. All my vendors, they store for me. I buy in bulk, store, and then have brought in what's needed. So from back in the day before I came, where you have your contractors there, and let's just say there's a couple electrical contractors and they need to get material. So multiple times during the week, two guys riding back and forth to the supply house. I manage my own material, basically with the concept, if you don't have the material, then you don't have work. So we actually do all that. That's 20% off the top right there for material. Didn't deal with Granger, even though everybody likes to see that 3% back, but at a 30 to 40% markup,
Mhm.
I can get 20 ballots for $140 from my vendor, and Granger charges $340. So if somebody wants to see a 3%, I could get my electrical contractor to show you a 20% return every year. So that, along with like I say, the contractor rate, that's the biggest thing. My thing to them is, you are doing nothing. I'm handing you money. We're
Yeah,
doing the
no,
time for you right here. We hand it to you. All you need to do is copy and paste it, throw it, send it back. It's your easiest job you'll ever have. So it's a lot of money in the end. And just for
Mhm.
example, the last time that I tried it in 2018 on in-house, I need a receptacle, my lights are too bright and all this stuff, it was $1 million. That was $1 million, not including the electricians in-house at New Hanover Regional Medical Center. So it was a big way to save.
Mhm.
Yeah, we also take, and so with engineers and projects, and y- when somebody wants to tie a load to a panel, so we have energy loggers, and now they're $4,000 a piece. Well, we have 8, and yeah, it's a lot of money. If you pay somebody else to do it, it's $2,500 a pop per 30-day session. I logged over 80 panels last year, so that times 2,500. And we
It's a lot.
have our
It
own
is a lot.
equipment. We keep everything, because when that goes to the project or to an electrical contractor and construction man, you may not ever get it. We retain all that. We retain all that information, all the login data. It's just another way to spend, to save. You spend, but in the end, you save.
In the long run. Yeah. And, that's a good way to look at that as well. Sometimes there are, it looks like short-term, gains, but if you look at the long term, that might be the bigger gain. So what is it? Penny wise, pound foolish. Yeah, thank you for sharing that. That was fascinating. And a good way to look at things. All right.
Chip?
My thing is, I understand the growth. I understand adding the facilities. I understand the reducing the use of outside vendors, and that's all good. The problem is they're not allowing us to add manpower to our teams. So my biggest problem is where can we save if we don't have the manpower to cover the facilities that we're getting? Prime example, in Winston, we have 6 facilities. I have 2 full-time upfit painters down at Rowan, 2 full-time upfit painters at Forsyth, which leaves me 4 shared services painters to cover 4 facilities, and yet they're still backed up. Because, like, as an example, the paint requests come in faster than they can get to them. So, if we keep adding facilities, at some point we have either got to depend more on outside vendors, or we've got to start raising our manpower on these teams.
Yeah, that's a legit concern, and I think that's something that you raise up, because I can see that if you get facilities as they age, they need a little more love, right? They need some more work.
Yeah.
So I would say if that's something that you're seeing in forecasting, that we're going to need this more in the future, then I would raise that up to your one up and say, hey, let's talk about this.
Oh, yeah. Ken Mowry and I have had discussions, and he tried to add, I believe it was 3 painters and a lead painter position for this year's budget. And I've not heard, but I doubt if we got it.
Yeah, I don't know off the top of my head if they were added in or not.
Yeah, I haven't heard yet. So,
yeah.
But I mean,
We're
that's just there's talk about expanding north, like in the Mount Airy and King, and where are we going to get the people to take care of those facilities? Where are we going to get the people to bring those facilities up to Novant standards? Unless we use outside contractors, and at that point, you're not really saving anything.
Yeah, I see what you're saying. And it's, is it a short term, get them up to speed, or is it there's some long term in there where we're going to need people to keep maintaining? Yeah. Yeah, that's that's the balance that we have to strike. And if you haven't heard already, I mean, our finances are pretty tight. And so again, this is really good timing for this program to come through, because we do need people to be mindful of what we're doing, and we're all putting our best foot forward so we can achieve those goals and we can be able to add those people like we would like. All right. So which of the following best describes an income statement in a healthcare department setting? What is an income statement? Give it your best guess. Okay. It is actually, yep. Number one, a monthly report comparing our actual revenue expenses against the budget. So income statement is the revenue minus expense section. This is my world. This is where I live. So we're gonna walk through that, and we're gonna talk about some terminology here. So on the back end in my land, we will operate on what's called the matching principle. And this is where we want our revenues to be recorded in the period that the services were rendered, and we want those associated expenses associated with that to be in that same period. We want those two things to line up and match. So, what's your part in that? This is where we're looking for managers and operations leaders to make sure that expenses are turned in. We're looking at our financials to make sure that things are getting paid, and in our revenue generating areas, we're looking for charges to be posted and as close to the data service as possible. The income statement, again, this is my world. This is the department budget variance report. So we're going to take a look at one of these and how it's set up, but it's a monthly report and it summarizes our revenues and our expenses. And then we're going to look at, it gives us a current month view and it gives us a year-to-date view. And productivity. So productivity, two kind of definitions here. So productivity is overall, it's labor management. This is the salaries section on your income statement. There is a separate process on productivity where we look at that, like, are we staffing appropriately compared to the demand that we have? All right, controllable expenses. These are salaries, benefits, med-surg supplies, other supplies, repairs and maintenance. But mostly, I want you to think of a controllable expense as anything that you can influence. Anything you can influence. Controllable expense. So things like equipment rentals, right? We can look and see what kind of equipment rental prices that we have out there. Salaries, that's flexing people on and off. Yeah, you're fine. We can move to the next one. So those are just some general terms. We're going to start with budgets. And the reason we're going to start with budget is because it is the beginning of our process for the financial measures. So we're going to go over this again in the next class we have, but this is what we're going to measure against on a monthly basis. So Novant has a pretty detailed process here. In the finance world, this takes several months to complete. So you can see we kind of start prepping in June, and then we run it all the way through January before it actually gets loaded into the ledger. And all throughout this cycle, we are running these like 2 weeks sprints of what we're doing and trying to get information in from external sources where we're meeting with people, and then we're pushing that data into the system, and then that creates some individual budgets for us, and then we roll it up and we try to figure out where does that land us from where we roll up to and where we want to be. So plant engineering, you get a budget. It's called a static budget. And this is, we help create this. We work together to create this budget. And it's what we know at the time. And of course, in between, life happens. We can tell just by this snow that we had. Life happens, and we might not have predicted for that. So we're just looking at it, trying to tell our story. What do we have? What did happen? And then we're managing those dollars as necessary through our review of that income statement. So static budget is this original budget that we help create, and then we have that monthly, and then we're measuring against that on the month. Okay. So with this, here's kind of the big picture. There's two big pieces. There's to a budget. There's volumes and revenue, and there's operating expenses. We're going to live more in this operating expenses, but it's important for you to know how this comes in, because there's like all the pieces need to come together to make this financial engine kind of run. So we start with estimating volumes. What is that? That's who is coming through the door. That is, institute leaders. So this is our HVI, orthopedics, behavioral health leaders. They're all saying, hey, what do we think is going to happen? Here's what we think are going to happen with our payers. What are we not going to get paid? And that's going to leave us with a net amount of revenue. And then we work kind of hand in hand with the operational leaders, and you'll see us finance people will be on a lot of calls. We'll be at the facilities, in the clinics, meeting with these managers, looking at these budgets and saying, hey, what do we think is going to happen here? So it's not just an out of the air creation. We're looking at 6 months of history to base our operating expenses on. And the system kind of forecasts that for us and says, okay, if this is what you did in the first half of the year, here's what we expect you to do in the second half of the year. And it's kind of a rinse and repeat. Now, this is where, again, you guys come in. Your insight is valuable to how your department runs. So you may know of some things where you had expenses in the beginning of the year that you do not expect to repeat in the latter half of the year. We might want to pull those things out. Or conversely, you might have things that we normally pay at the end of the year. Okay, Otis Elevator pays in October. Well, that's not in my first half of the year budget, but I know I'm going to pay it. So I need to make sure that I have accounted for my Otis Elevator expense in my budget. So this is where we look at those things. We're working hand in hand with you all to create that budget. We apply some assumptions to these things for labor costs, for supply costs, inflationary factors that we think are going to affect us operationally. We bring those revenue volumes together with the expenses, and we have the big picture. So this is, again, all those pieces roll up, and we get a look at, did we reach our goal or did we not? Here again, let me talk about what we're doing here. So thanks, Lindsay. We have a certain goal that we're trying to get to again, so we have that capital that we can reinvest. It's typically been about 10% of what we're calling OCF, that's revenue minus expenses. So we're trying to get there, and when we roll things up, typically we don't make it the first time, and then we're looking for ways to get to that goal. And these numbers are approved by a board. So there's a Novant board that sees our numbers and says, yes, we like your plan, or we don't like your plan. But tell us how you're going to get there. Why are you achieving this year 9% OCF versus a 10% OCF? What's going on? So we have oversight because we are a not-for-profit. And once those budgets are approved and finalized, we put them in the system, and then that's what we're using as our guide. Okay, so next slide. Okay. So for budgeting, you need to have a good, solid understanding of our current state, what's going on. We also need to know that our fixed budgets have costs that shift. We want to plan ahead where we can, but life happens. So if you have things that are coming up, bulk purchases that are coming up, if there's our change in kind of protocol that affects what kind of supplies we're going to need to have on hand. Are there any changes in contracts that are coming that you know of? So these kinds of things. Keep in mind what is going on in your department. And then we use tools, and these tools are what we're going to go over. So we're going to look at our budgets when they're available. They're not in the system yet, but we're going to pull them out and look at them, so we know what our goal is for the year. And then I'm going to say, the key is to manage your budget in total. So let's go to the next slide. This is something that's key to know the difference between operational expense and capital expense. So we're talking about what operational expenses we're going to put in that budget. Well, some things could be capital, some things could be operational. In plant ops, we do a lot of verification to make sure that things are in one category or the other. Because we typically have some high dollar items in here, but they are sometimes they can be operational. I know, like Will has been working on a collapsed pipe, and that's operational expense, every last bit of it. Even though the definition looked like it was over, you can expect capital is something that's $5,000 or more in cost, and it can be used more than once. So in plant ops, that's a lot of things that we do. So we want to check with your finance person and see, hey, is this a capital item or is it not a capital item? So do I need to put it in my operational expense, or do I need to run it through the capital process? We want to make sure that we separate those two things and get operational items in the budget. Okay. Lindsay, how are we doing on time?
We're a little on time. We've gone over an hour, so it's a good point to take a break.
Okay.
We are scheduled to be done at 11:30, so that leaves us 30 minutes when we get back. So I know we've got some more slides to get through, but we might end up running long, so we might have to lose some people, but we've got about 30 minutes of scheduled time when we get back.
Okay, perfect. Thank you.
Welcome.
All right, that's a lot of material. Let's take a break and I'll see you in 5. All right, we're going to make the most of our last 30 minutes here, and we're going to dive into our financial reports. So again, welcome to my world. This is you're going to look and see it's some of these things that I want you all to be familiar with and understand what this income statement is, what it looks like, and how to find information on it. So the income statement, so we've done all the budgeting, we roll it up, it's got revenue, it's got expenses, and that leaves us with the operating income, like revenue minus expenses is operating income. So those are the pieces to the income statement. Remember revenue and volumes, and then there's expenses. All right, next slide, please. Okay, so where do you find this thing? Where do I find my income statement? It is in a system called Strata. Access, just so you know, Access is generally for manager and above, and that's for confidentiality reasons. Because you might have, if you're a supervisor, your one-ups payroll information may be in there, and that's a confidentiality problem. So just know that that's how that's divided out. And we get to this by logging into our system called Strata. We come out here to iConnect, and just know I am purposely going to go through this rather quickly because I want to get to a point where we're actually looking at the income statement. So that you will get this slide deck that's got the information on here. So we're going to go to iConnect, select this tools and services. That's going to bring us to this screen, and we're going to click under financial services. And then we're going to select Strata. It's the system with 3 names. And that's going to get us to our Strata homepage. So that yellow section at the top is important. It gives us information about, it'll tell you if you'll have a banner notice on the announcement that says, hey, December information is available. You can go get it. All right, so Strata homepage. And at the top, there's
We lost you for a second, I think.
Oh, I'm sorry. We can get the income statement from either one of these selections, analysis, or the performance. So next slide. All right. So under performance, you can select this management reporting. And it's going to bring you to this screen, and then we can enter our department number in here. And remember, it uses the spaces and the dashes. So you enter your department number and it'll pop up, and you can select that, and you can tell because it's got the blue hyperlink on it that that's going to take you to this summary page. All right. Now, the second piece that we're going to look at is through the analytics tab. So if you do analytics reports, and then it's going to, here you want this MR, which is management reporting. You want the income statement summary. And it'll bring you to this screen. So this option, you need to select your month. And I will tell you, Strata is picky. So you want to use that little X there to clear out your month, or else it could It could bring in more than 1 month. So use your little eyeglass there, your spyglass to or magnifying glass to look for your month. So use your X to clear it out. Use your magnifier to make your selection on the month. Run your report, and it's going to put it in a download folder. That download is going to pop up on your screen for just a second, and you can grab it there. Now that gives you a summary. Now this is a detailed income statement. This is the one that I recommend that you look at. So if you select the detail, brings you to a similar looking screen where we're going to modify. So it's got our department at the top. We're just going to change our month and our fiscal year as appropriate. And then it will again make a download. And this is the income statement. Now on here, you'll see some buttons on the left side. If Lindsay, could you go to the next one? Next slide, please. Yes, there we go. See those plus buttons? Those expand. And under each one of these categories, the income statement is divided into these categories of expense. And under that expansion, if you hit the plus button, it's going to give you accounts of expense. So your repairs and maintenance, if you expand that, you'll be able to see plumbing labor, plumbing materials, things like that. There are other reports that help us dive into that. So this set of reports it's like an onion. So this is the top layer, this income statement. It gives you a broad view of what's going on. And we start here and then we drill into what expense lines we want to look at. And then we use these other reports to find further information, but we start here. Okay. Next slide, please. Okay. So these, when you're looking at your income statement and you're looking for additional information, you can find things under the AP distribution report, the DTB. That is, it's basically a general ledger report, but it's a detailed trial balance. So very accounting term for that. And then there's the R&I report. Is there another piece to, yeah, thank you. So there's some explanation here. DTB, detailed trial balance, that is your next step. So I've looked at my income statement. I've found an account. I'm going to go to this detailed trial balance and I'm going to find out, because I know what account the expense is in. And then I'm going to look further and say, well, what kind of expense is it? Is it an AP expense? Is it a PO expense? Is it a GL, somebody journalized this to me type of expense? So this is where you start peeling back those layers and finding out where did this thing come from and what additional detail can I get from it? Yeah. And then this just tells you, so start here with your income statement, find your expense line item, go to your detailed trial balance, and then you can find out, is it an AP expense? Well, I can go to my AP distribution report, and this has information like your vendor name, your PO number, an item description, an invoice number and amount. So it's additional information. You might say, oh, okay, I remember what that is now. The R&I, that's received but not invoiced. So these are PO kind of transactions. So they list vendor name, your PO number, the items and the unit cost and your total amount. So additional information in there. Now, sometimes it gets down to where you can't drill in any further on your own, and call us. We will help you. All right. So this is an example. Can we go back one? Thanks. This is what I wanted to show you is an example. So on the left side of the page here, we have that income statement and it's expanded. So we saw the income statement and it had lots of different line items. It had the little plus buttons to the side. And I want to look in here in repairs and maintenance and see what is that driving that cost. I've got $934,000 of cost in November for repairs and maintenance. I want to know where that is. Well, I run my income statement. I hit my plus button on this repairs and maintenance section. And I can see that there's mechanical labor here under this account number 61133. Well, that is virtually half of my total cost for the month. Well, I need to find out a little bit more about that. So then I'm going to go to my GL distribution, right? That's my next step in researching. And I run that report for the same month to see what that is. And you can see here, these are both highlighted. So on the income statement, I have a summary line of all the expenses that hit mechanical labor for 440,000. And then when I look in the GL distribution, that same amount, 440,000, and is there. And then these are all the pieces that make that up. Okay, so strata income statement. There's our sample on the left side again. So we have, we're going to be here in this expense area because we're non-revenue generating. So we're going to be salaries, benefits, med-surg supplies, drugs, all of that. We won't have a lot of because we're not nursing. We're not an OR. But we have a lot in repairs and maintenance and other expense, and some in our outside services. So we want to know what's in there. So the last line on the income statement is showing our contribution margin. So, or what we have, what we brought in. And on the facility as a whole, we'll have a number there because we've got revenue. Here, we don't have revenue, so you can see our contribution margin or our bottom line looks like it's a negative 2.2 million. Well, that's the cost of doing business. That's what it cost us to do business for that month. I know we were going to take a break here for 5 minutes, but we just had one, so let's keep trucking. Here is where we're going to talk a lot about our staffing and our productivity. So we know that productivity is that salary line item, right, on our income statement, and we're looking to manage that. We have a process called productivity where we look at expenses, salary expenses on a biweekly basis. And we're measuring that as a tool to say, what's our workload and did we have enough people to cover it efficiently? So we're looking that on a biweekly basis. You can look in Strata and see what this means for your department. So there's some place we're going to look in here and find out what's going on. I do want to preface this by saying plant operations, we are considered fixed department. We need to be here all the time. My area is the same way. We're here all the time. So we're a fixed department. We run off of calendar days. but we do backfill. So if somebody's out in, you know, Jeff, in your area, you still need somebody to backfill. So you might bring in a PRN person, or somebody might work some overtime to help backfill for that slot. So those are things that are going to be some drivers usually of any differences that we have. But this piece that we're going to look at, this Strata productivity tool, is going to be a dashboard that we can look at. So in Strata, to get to this tool, we're going to go under performance. And then instead of doing that management reporting, we're going to go under our productivity reporting. We're going to select that. In our next screen, which is at the bottom of what we're seeing here, is where we're going to put in our number for Plan Op Services, and we're going to double click on that because you can see that that's a blue hyperlink. And then that's going to bring us to our next slide, which shows this dashboard. So some of the things that we're looking at here for productivity is we're going to look at our paid FTEs. So productivity for a fixed department is what our goal is to not to pay more than what we're budgeted for on FTEs. So this includes our paid time off as well. So PTO is in there for fixed departments. So in this example here, for our total pay period, this department had ran 41.3. That's in our actual. And then the target was 49. So we ran what we're going to call productive. So productive means that you were at or below your target. So we ran less FTEs than we were allowed. So we're productive. I do not have it circled on here, but if we scroll up, Lindsay, could you point to under the actual column, there's a 1.22 at the top. Kind of in the box, there's the box on the left, 1.22. This is our productivity percentage here. So this is telling me this department, yes ma'am, is 122% productive. So if we're at 100% productive, we're meeting our goal. And this is saying we ran better than that. So there's, on the left side, this left box that's outlined is showing a current pay period. So it is a pay period look. And then on the box to the right, we can see year to date. So how have we been doing throughout the year? And again, when we look at our total paid FTEs, we're looking at, we ran 39.52 and our target was 49.51. And we're over 100% productive. Now, that could be for a couple of different reasons. It could be that we have unfilled positions because we haven't been able to recruit. So that could mean that my people are working like crazy and I might have a lot of overtime. Or it could be somebody was out on FMLA. And it could mean that we just had a higher budget than we expected, and we've been able to run pretty lean and pretty efficient. Now there's double-edged sword, right? So we can, if you're running productive, and you're running at that 100% or more, especially if it's the or more, you don't want to get on that hamster wheel of burning your people out. So that can create problems on its own if people get burnt out and then they leave. And then you have to backfill them and you have to train them up. And all of that takes time and resource. So when we're looking at productivity, I want you to think of it in a holistic kind of view. Am I running productive? Am I being efficient? So those are all the same things that you guys were saying earlier. Am I being efficient? Am I balancing how much I'm running my people, and do I need to run overtime to do this? If I do, is that because I cannot get talent in here? Am I short-staffed? What is the reason I'm short-staffed? Do I have somebody out on FMLA? You know, we need to draw that whole picture and find out what's going on. Next slide, please. Okay. Now, if we wanted to, we could look at the entire month by selecting the monthly option versus the pay period option. So this is just showing that there's a way to look at this monthly or by your pay period. I very rarely look at this monthly. I think you're going to find that you're going to look at your productivity on that biweekly basis. We have biweekly meetings around productivity where we're looking at this across all of the facilities. Every single region does it. You can export this data in reports. So in the top right-hand corner, there's a reports option. And yeah, and you can export that. So if you're looking to do that, we can walk you through how to get those reports. I find it's better to do hands-on and work with you guys one-on-one to get those reports to come out. All right, next slide, please. All right, here's what I want to get to. I want to get to an income statement, and I want to look at what we might want to look at. You know, what do we have in our numbers and what are our numbers telling us? Okay. So here's a sample income statement. I want to walk through this, just the setup with you so you understand what it is, what it's telling you. So on the left side, we're going to start with the current month. So we've got on all the way to the left. Yeah. So all the way to the left, we've got the salaries, benefits, and you can see this example is showing the month of April. And so our what we're comparing to is actual versus budget. So on our top line, we've got, and that's going to be, Lindsay, it's going to look where it's like E33. Yeah, so here we go. We've got, in salaries, we've got almost $300,000 worth of salaries. And then to our right is the budget. I want you to skip over the flex. And we want to look at the next column, which is the variance dollars. So that variance is telling me actual versus budget. So it's taking your budgeted dollars and subtracting them from your actual. So in here, this is where we're looking at, and we're saying, hey, if I was looking at an income statement, this is what I would look at. I'd look at my actual versus my budgeted, and I'm looking at that bottom, I would start looking at that bottom line with total operating expenses. So the total operating expenses for actual are $2,281,572. And my budget for the month was $1,928,727. So I already know I spent more than this current budget allowed. So I'm going to need to look at this and see what's driving up that cost and why. So starting kind of from that top, we can use that column K and look at those differences and say, what's in here? What is the largest expense that you see in here? Where is the largest variance? So if we're looking at column K,
Repair and maintenance.
and if you just want to just speak up and tell me what you see.
All your variance was repair and maintenance.
Sorry, Will, say again.
All of your variance was repair and maintenance.
Yes, repairs and maintenance. So there, we're looking at a difference, $351,331, right? And that's the bulk of the difference in there. So we can see that in that column K at the bottom, we're $354,844 over our budget. So we're unfavorable. So we see those brackets, it's unfavorable. Well, we want to see what that is and why it's like that. So the next thing I would look at is, okay, that's my month, and I've identified that repairs and maintenance is definitely an area that I want to look at, but I also want to see how have I been running year to date. So I'm going to use our example right now with the snow, right? We didn't necessarily budget for snow removal and crews and all the extra we had to do with the inclement weather. So I'm going to manage my budget, and maybe I need to, I've run under budget for part of the year, and year to date, I'm okay. So this is where I want you to look at managing your budget in total. So you might have a large expense for 1 month, but year to date, we're okay. So I'm going to look at columns O and S, and I'm looking at those two for year-to-date actual and year-to-date budgeted. And then I'm looking at column W to see how I'm doing. So in the current month, I'm over budget. Am I over budget or am I under budget year to date?
Under.
Yeah. So we're under budget year to date. I think I think you might have said that. Well, I'm having a really hard time hearing you.
Yeah, I don't know can anybody else hear me okay, or is it me?
Okay. Yeah, I'm under budget. So I'm actually almost $100,000 favorable. So my story is I've got to dig into the current month and see what's going on. And then, but year to date, I'm within my budget, even though I've got expenses plus and minus on different lines. So for the rest of the year, I'm going to have to watch and see, what do I need to spend? Are there things that I can, hold on spending until I kind of even out? Maybe there are, maybe they're not, but definitely, watching your salaries and then looking at those spend items, particularly discretionary spend, things you might not need to spend, but they would be nice to have if I had them. All right, I know we're close to time here, so I wanted to use that income statement as an example of, you know, how I would look at things, and this should help you with your homework. And as we wrap up, let me know, do you have any questions? I know that was quite a bit to go over. Thank you all for being here. I appreciate you. I appreciate your input. I think you had some good insights. And we'll go over some of this homework when we come back and we meet about budgets, and we'll go into the budget process more in depth. If you come up with any questions or examples that you want to share, please feel free to come with those to the next session.